I'm Ashley Winroad. I'm a physical therapist and I work for Riverside's home health department. An average day for me, I usually start my day, I pull up my computer, I check out the patients that I'm going to see, kind of get a review of them. I usually see anywhere from 3 to 5 patients a day, just kind of depending on the visit types. So I go out, I do my patient treatments, I'm calling doctors, I'm calling our office, I'm updating our other field nurses on our patients, I'm updating our PTAs, so making a lot of phone calls, doing a lot of treatments. And then that's most of my morning, early afternoon. By the rest of the afternoon, I'm doing my documentation, I'm chart reviewing for my patients the next day, and I'm calling my patients to prepare their times for the next day. I feel like as a home health clinician, we have a huge impact on our patients. As soon as they come home from the hospital, the skilled nursing, they're in a rehab facility, we are some of the first people that go out and see these patients. So we're the first medical professionals to come out and actually treat these patients. So what we have to say, they're really listening to. So getting to go out in their homes and teaching them safety in their homes and making sure that they can be safe and independent in their homes is a major impact on them. So that's really how we impact our patients. It's taught me to be very creative. In most PT settings, you're in an outpatient setting, you're in an acute rehab setting, you have equipment. So you have all kinds of things you get to work on with a patient. When you're in their own home, you get to be creative and figure out ways that you can treat them without using all that fancy equipment that you always get. So it teaches you to be adaptable. So I've really learned to take their environment and teach them the best way to be safe and independent in their own environment, but still be creative with it and make sure every treatment's not exactly the same. Honestly, I do love my job. I love the flexibility of it. We do kind of schedule our own patients, so I get to make my own schedule, I get to go out, I see my patients, I get to see my own patients in my own community, I get to do one-on-one treatments with my patients in their own home. And I feel like that really makes the patients a lot more comfortable because they're in their own environment. So that's really nice that the patients feel comfortable with you being in their home and treating them there. Riverside family to me means having a support system. I know that I have a team behind me that I can confide in and trust in, and I can go back to any of my team members and talk to them about anything I need, anything in the job. So just having that family that I can confide in and trust in is really what the Riverside family means to me. And being with Riverside, I know I have that.